This is our presentation on motion sickness by Liam and Natalie.
So, what is motion sickness? Motion sickness is nausea that's caused by motion, especially by traveling in a vehicle.
Okay, so some of the risk factors for motion sickness are traveling on a plane, in a car, in a train, or on a boat, or when you're on a roller coaster. When you're under the age of 12, if you're prone to nausea, have a high level of fear, anxiety, or have poor ventilation in a vehicle.
And on the right, we have a giant list of symptoms, the more important ones being nausea, which is very common, dizziness, vomiting, and fatigue. So what causes motion sickness? So essentially, the main causes of motion sickness are when your brain is receiving conflicting signals from different parts of your body that are all giving different information. So the main sources of this info are the muscle and joint sensory receptors, which are also called proprioception, and that tells what parts of your body are in motion and which ones are still. Now that's important because you need to know when your body is moving or not, like say if you're in a car. Then there are also pressure receptors in the joints and the lower extremities and the spine, so say in your legs and in your lower back, and those tell which part of your body is down and touching the ground, so you know which way you're oriented. The third is your inner ear, which is also called the labyrinth, and that monitors the direction of motion, such as turning, rolling, forward, backwards, side to side, up and down, and other motions. That's why when you're hanging upside down from a tree, you know that you're upside down. The other reason that you know that why you're upside down is because everything looks like you're upside down, which is where the eyes come in. They monitor where your body is with relation to other objects, and also which direction it's moving in. So again, motion sickness is caused by conflicting signals from all of these different inputs going to your brain. So for example, your eyes say, I'm not moving when you're in a car if you're looking down, but the rest of these parts of your body will say, yes, you're in motion, and then you get motion sickness. So, a big part of motion sickness, or of the organs that are responsible for motion sickness, are in the vestibular system, because those are important in coordinating body orientation. So your eye movement, your head, your balance, your sense of equilibrium, your posture, your body movement are all coordinated by the vestibular system. So on the photo down here on the left, we have an image of how the vestibular system sends out signals via neurons to the rest of the body, and especially to the brain. And then on the right, we have a photo of the semicircular canals, which I'll talk about a little bit more in a second. There are 3 semicircular canals on either side of the head that are matching the other side, and those sense the rotation of the body. So when the body moves, a neuron fires, and there's a signal sent. So the organs that are, wrong slide, there we go. The organs that are most important when the body's trying to orient itself are the otolith organs, and then of course the neurons that are sending the signals. So the otolith organs are responsible for detecting orientation of gravity and tilt. Like I said, the semicircular canals also assist with head rotation, and then the hair cells, which are the purple over here on the right, detect changes in body orientation, and then you can see that they're directly connected to the vestibular nerves down below. So, like I said, the neurons then send signals to the brain, and those coordinate with one another, and when those are conflicting, you get motion sickness.
So now we're going to talk about the causes of the symptoms of motion sickness. So the most common symptoms are vertigo and lightheadedness. Vertigo is experienced after a change in head position, such as lying down, turning in bed, looking up, or stopping. It lasts about 30 seconds and ceases when the head is still. It is due to dislodged otolith crystals entering one of the semicircular balance canals. Lightheadedness is a lack of blood flow to the brain, which is often experienced upon standing up or sitting down, known as head rush.
So those are 2 different, often confused symptoms that both happen when you're motion sick.
So now the cause of nausea as a result of vertigo and motion sickness. So after the signals travel from the vestibular system that Liam talked about, another contrasting signal is sent from a different part of the body, and these messages conflict, and they both travel to the emetic center, which controls vomiting, and it's located in the medulla. So the pathway from the vestibular systems in the vestibular canals release neurotransmitters called histamine and acetylcholine, which interact with the H1 receptors and the muscarinic receptors. So once they signal a pathway, it causes nausea and the body's response to vomiting, which travels throughout the body to the stomach through nerves.
Which is why the week of heart puke on roller coasters. Now, how do you deal with motion sickness? So, these are just kind of Part of them are kind of wives' tale home things, but there actually is a lot of science to back these up. These are some things that people do to deal with motion sickness. So homeopathy, acupuncture, dietary supplements, so there's like Dramamine things you can take, changes in your diet. So I think a lot of people who travel know that peppermint, ginger, fresh fruit are believed to help with relieving motion sickness. And then also physical exercise, which is why you feel a lot better if you go for a run after you get off of a plane, and avoiding greasy foods and not smoking are all important.
So now we're going to talk about the medicines that can treat the symptoms of motion sickness. So one of them is a patch that you put behind your ear 6 to 8 hours before you travel. It's called transdermal scopolamine, and this has to be prescribed by a doctor. But the most common medications, such as Dramamine, are available. They're over-the-counter drugs, and you can take them before you travel. So these are called antiemetics, and as we talked about earlier, the pathways release histamine and acetylcholine, which triggers the vomiting response, and these drugs block their receptors in the medulla and prevent the nausea signal from traveling throughout the rest of the body.
Okay, that is all we have for you guys. There's our bibliography. Thank you so much, and have a great day.